Dyslexia. In the United States, 15 to 20% of the population has a language-based learning disability, dyslexia being the most common. If detected early by testing and recognizing the presentation of the disorder, the lifelong impacts of dyslexia can be minimized to help students reach his or her full potential. Dyslexia has a complicated definition, and there's not one single source that agrees on a universal definition. A few conditions or disorders should not be confused with dyslexia, including attention deficit hyperactivity disorder, or auditory acuity disorders such as a hearing loss from chronic otitis media. In simple terms, it is a language-based learning disability. This includes many aspects related to language and reading acquisition. People who have dyslexia often have difficulty with spelling and decoding of words. This is related to the difficulties students with dyslexia have in their phonological skills. Without the ability to match up sounds to their corresponding letters, this can make it difficult to read fluently. Dyslexia appears to occur roughly equally in both sexes and is not affected by socioeconomic, cultural, or ethnic backgrounds. The one factor that has been identified as increasing the risk of a student developing dyslexia is if a close family member had the diagnosis, especially a parent. People with dyslexia have a difference in how their brain functions and processes information. Several differences have been documented. They include creative perceptions, increased awareness of the surrounding environment, above average curiosity, thinking in mental images, an intuitive thought process using all of the senses, and a very vivid imagination. This can result in the student having a high IQ and being highly creative. Some very famous people that had dyslexia were Hans Christian Andersen, Alexander Graham Bell, Albert Einstein, Henry Ford, Jay Leno, Charles Schwab, Woodrow Wilson. People with learning disabilities are often tested when there's a gap between the student's potential and what academic work they are producing. Because of the implications for current and further learning, a diagnosis of dyslexia will qualify a student as having a learning disability, which will allow them to obtain an individualized education plan, or IEP. Once a student has an IEP, this allows the school to provide services and supports needed for that student to succeed in the classroom. One of the biggest myths of dyslexia is that people with the disorder read backwards. Students with dyslexia may have jumbled spelling, but are not reading the words backwards. In reality, this is due to the person having difficulty forming sound-letter relationships and being able to make memories related to words. Some of the more common symptoms that a student may have are difficulty in learning to speak oral language, learning what sounds letters make, trouble with spelling, learning the alphabet or days of the week, rhyming words, pronouncing words correctly, and trouble learning and remembering sight words, letter or word reversals, and confusion of small words, for example, at and to. In older children, 3rd grade and higher, they may have difficulty with all of the previous listed in addition to understanding directions, naming of objects or people, speaking smoothly, reading with age-appropriate fluency, feeling confident in reading, and increasing vocabulary use with accuracy. A student with dyslexia in the classroom will have difficulty remembering sight words and other words that can have multiple meanings because it is hard for them to form a mental picture of the words. Some examples of the most common words the students with dyslexia struggle with are again, do, in, me, not, or, they, within. Problems with dyslexia. Problems with the auditory side of language, the way sounds are translated into different symbols. Difficulty recognizing letters. Struggling to link multiple words together, even if individual words can be read without a problem. Difficulty with language comprehension. For example, taking a long time to process words. By the time the end of the sentence or paragraph is reached, the beginning has been forgotten. Next to reading, spelling is the next highest area of difficulty for students with dyslexia. If a student is having a great difficulty in spelling or matching up letters and sounds, this may indicate further testing or evaluation are needed to see if a possible learning disability, such as dyslexia, exists. Spelling problems, like reading problems, are from a language learning weakness, not a visual memory problem. Early intervention and diagnosis of dyslexia and other learning disabilities are crucial to helping students not remain poor readers. Students that are poor readers in early elementary school continue to lag behind peers and remain poor readers. This emphasizes the need to identify those students early and not let the gap grow. All students need to master the alphabetic principle in order to learn to read fluently. The alphabetic principle is the ability to understand that there are systematic and predictable relationships between written letters and spoken sounds. Once children are able to identify and name letters with ease, they can begin to learn letter sounds and spellings. This is something that people with dyslexia struggle with for their lifetime. Several warning signs present themselves. If a student has trouble or difficulty with the alphabetic principle, they may require further testing and evaluations to rule out other warning signs, such as having trouble learning to recite the alphabet, or days of the week, or numbers 1 to 20, trouble rhyming words, having a small vocabulary, having difficulty recognizing beginning sounds, and remembering names of people and places. Several screening tests are available to screen students thought to be showing signs of reading difficulty. They include predictive assessment of reading, dynamic indicators of basic early literacy skills, Texas Primary Reading Inventory, academic improvement measurement system based on the web. It is recommended that every child be given regular testing, usually one of the above tests starting in kindergarten, which would help identify students at risk of developing reading difficulties. Not all students identified as being at risk for reading disorders have dyslexia, but the earlier students are identified, the less the achievement gap will be with their peers. Testing should focus on phonological awareness, memory, and rapid naming of objects, which would also identify what students will benefit from specific instruction in these skills. Intelligence testing was once considered necessary to prove that a student had dyslexia, because if a student had normal or above normal intelligence and had difficulty reading when they were proven to have dyslexia. Since this has been removed, schools can now focus on how to best serve students with dyslexia. Schools no longer have to wait until students fall behind or use the discrepancy model. A background history is important to obtain in a comprehensive evaluation, because a language delay is an early sign of dyslexia, but has usually corrected itself by the time children enter school. Brain imaging studies have also been conducted with results showing a significant difference in brains of individuals with and without dyslexia. Brains of people with dyslexia show that they are not activating the same area of the brain as good readers. Since reading is a code we must all understand in order to be fluent readers, scientists are able to better understand what therapies and interventions might increase reading success with people with dyslexia. There is no clear definition or one test that can diagnose a student with dyslexia. Instead, a diagnosis of dyslexia should include a comprehensive look at the student's developmental history, family literacy history, early learning opportunities history, classroom observations, examples of students' work, several kinds of varied testing. People often wonder if it is possible for students with dyslexia to learn to read and write. The research is clear that yes, people with dyslexia can learn to read and write, but they also need to be identified early and given proper intervention to be successful. The instruction students with dyslexia receive needs to be taught by a systematic and explicit method that involves several senses, hearing, seeing, touching, at the same time. Multisensory instruction is crucial for students with dyslexia. The Orton-Gillingham style of instruction is a multisensory approach that relies on a step-by-step instruction that utilizes touch, vision, and auditory aspects. The Orton-Gillingham instruction methods have been around since the 1930s, when it was developed by Anna Gillingham and Dr. Samuel Orton. It was developed upon the premise of rethinking the way people with dyslexia were taught to read. The model built upon itself a multi-step sequential system that incorporated all the students' senses: kinesthetic, tactile, visual, and auditory. It includes components of learning the sound-letter relationship, how sound relationships are in words, and also to break down a more complex word. One of the first things to adapt or modify for students with dyslexia is the instructional style that a teacher uses in his or her classroom. This can be done in several ways. The suggestions for instructional accommodations largely benefit students with dyslexia, but also other students at the same time. Teachers need to provide explicit teaching instructions, which include time to provide the child or student with organizational materials, demonstrations, guided practice, teacher feedback, student practice, teacher and student practice together, and review time. They also need to provide students with graphic organizers, copies of lecture notes, mnemonic sayings such as kids prefer cheese over green spinach to learn the order of taxonomy. For times of the day where reading is necessary, such as during sustained silent reading, or SSR, allowing students with dyslexia to listen to age-level audiobooks gives them a great opportunity to build on their knowledge base, improve vocabulary, and increase self-esteem. Other accommodations for students with dyslexia can take shape in the form of material accommodations. Allowing students to use a tape recorder to listen to lectures from class or tapes of a textbook passage allows the student to still get the material because the reading aspect will not be interfering. Adapting of homework or in-class work can be made by simply reducing or adapting the amount and kind of work the student has to complete. Teachers can also extend or change deadlines and requirements. Students with dyslexia can get distracted by too much stimuli on papers. The teachers can correct this situation by covering up or eliminating pictures and extra wording not needed for the assignment. Traditional methods of spelling do not work with students with dyslexia. An accommodation would be to let the student know privately that you're not going to grade their paper based on their spelling, or that they can have an alternative assignment. This can cut down on the stress of learning to spell at the same rate as their age-mate peers. In conclusion, a multisensory approach to teaching students with dyslexia allows them to reach their reading, writing, and spelling potential without unnecessary loss of self-esteem and academic problems. Independent, scientific, replicated research supports the use of reading and spelling system that is simultaneously multisensory, systematic, and cumulative with direct and explicit instruction in both analytic phonics and intensive practice. Organizations for people with dyslexia or teachers are the International Dyslexia Association, the National Center for Learning Disabilities, National Institute of Mental Health, Learning Disabilities Association of America, and the National Institute of Child Health and Human Development.